coming out today. You have been listening to the Governor Whitmer's news conference with an update on all the latest with COVID-19 in our state. A quick recap: 32,000 positive cases, 2,469 deaths. That's 77 from the past day. She does say we are taking a limited action for a limited amount of time, and went on to defend her decisions, talked about reopening the state. We've got many more details on what just came out over the past hour, so don't go away. First at 4 starts now. And we will start First at 4 with the breaking news from the governor's office. She is facing pressure right now from Republicans to reopen parts of the state more quickly. Governor Whitmer seems to have a different focus. We'll explain what she said. Paula.
Karen, we have an incredible story of a local woman who is putting aside her own grief to feed those who don't have time to feed themselves. This one will touch your heart. Ben?
Paula, rain rumbles and a potential record all in the way in the next 24 hours. Plus, what does the rest of the week hold? We'll check it all out for you right now. First at 4.
Local 4 News starts now. The breaking news alert.
Good Monday afternoon. I'm Karen Drew. First at 4, breaking news on the battle to reopen the state of Michigan during the coronavirus crisis. You may have just heard the governor speaking, offering her update following new plans from Republican lawmakers. Also, the Trump administration and Congress are negotiating a new federal aid package. The new $450 billion plan would boost small businesses, plus have money for hospitals and more COVID-19 tests. There's no timetable on when that deal might be done. Meantime, here in Michigan, we have now recorded 32,000 infections and more than 2,400 people. Let me correct that, 2,469 deaths, with families grieving all around the state. Another 77 in the past 24 hours. And one of those who died is 5-year-old Skylar Herbert. She is Michigan's youngest person to die as a result of complications from the coronavirus. Both her parents are Detroit first responders. Her mom, a police officer. Her dad, a firefighter. Mayor Mike Duggan says the loss is simply devastating to our city.
It's a reminder to all of us what's at stake with our commitment to social distancing, and I want the Herbert family to know that they're being held in the hearts of all Detroiters today.
And coming up at 5, you're going to see how Detroit is paying tribute to Skylar Herbert. And at 6, we're going to hear from her mom for the very first time. Now let's go back to the governor and the pressure to start reopening the state for business. Today, Republican leaders released their plans to start the process. Now, we just heard from the governor, but her focus seems to be on staying the course. Kimberly Gill in the newsroom. So where do things stand right now, Kim?
Yeah, hi, Karen. Good afternoon. Leading Republicans floated plans to start to reopen part of the state, putting pressure on the governor. But so far, she's resisting that pressure. Governor Whitmer did not outline her own plan. She says she's still working with leaders in business, and labor and health experts want to make sure that the state opens safely. Republicans are pushing a more regional plan. Listen.
I'll do my part to help us avoid a second peak. As tough as right now is, that would be devastating to start to reopen and then have to come back into the stay-home posture. We've got to avoid that at all costs, and that's what's driving the decisions that we're making.
We need to ensure that Southeast Michigan gets the PPE that they need, gets the testing that they need, and the additional resources that they need. But let's not be overburdensome in other parts of the state where thousands of Michigan families are hurting unnecessarily.
Now, the governor only offered a preview of the controls she thinks would be needed to reopen businesses safely. Things such as temperature checks for employees, increased testing and contact tracing. House Republicans want to divide Michigan counties into 3 tiers and start lifting restrictions in places that have seen fewer COVID-19 cases. Right now, Wayne, Oakland, and Macomb counties are in the highest risk category with the most restrictions. Today, the governor seemed reluctant to move that debate forward, but pleaded with all of us to stay home and stay the course for another 10 days.
President Trump called this a war, and it is exactly that. So let's act like it. In World War II, there weren't people lining up at the Capitol to protest the fact that they had to drop everything they were doing and build planes or tanks or to ration food. They rolled up their sleeves and they got to work.
We didn't hear a specific timetable on when the governor will announce her plan. She also announced that she's taking a 10% pay cut because of the crisis, and she's asked her executive staff to give back 5%. Our coverage of the governor continues tonight on the News at 5. We'll have more then. Until then, Karen, we'll send it back to you in the studio.
All right. Thank you, Kim. And a new phase of coronavirus testing begins here in Detroit for businesses deemed essential. Today, all essential workers in the city are eligible to be tested for COVID-19 without a doctor's note. Workers can get tested at the drive-through testing site at the fairgrounds. However, if you don't have a doctor's note, your company must call to make that appointment. Individual workers should not call on their own. In good health, local hospitals and universities are actively taking part in research to help find ways to fight COVID-19. Frank McGeorge is here with 2 new efforts in the area of patient care and testing.
St. Joseph Mercy Health System is participating in a clinical trial treating seriously ill patients with the plasma that's donated by people who have recovered from COVID-19. 11 St. Joe's patients are among the first 200 nationally to be registered for the trial that will include more than 1,000 hospitals across the country.
Eventually, what we'll be able to see across, hundreds of institutions and hundreds of patients is to kind of collectively see whether convalescent plasma is an effective therapeutic option. I think locally, even within a few days, we'll have some better information about how these patients have done in terms of those that received this.
Local researchers hope survivors will register with the Red Cross as a potential donor of convalescent plasma.
If you've recovered from COVID, it's important to realize that there are many patients still in the hospital that are having a very difficult time from this. And you could potentially provide a therapeutic option for them.
Now, in other research, Michigan State University has developed a new test for COVID-19. Researchers say their new testing method is 500 times more sensitive than the standard test, and that would help reduce the number of false negatives many tests give. Now, the Michigan State test also does not use the same reagents or chemical reaction triggers that other tests do, which are currently in short supply. Now, the MSU test is awaiting emergency use authorization by the FDA and could be available by the end of April. Back to you.
All right, thank you, Doc. A local woman is ignoring her personal pain to tend to the care of others. As a caterer, she is uniquely qualified to feed lots of people. And while she has always had a focus on feeding the needy, she is feeding a new need, helping our frontline workers. Paula Tutman live in Pontiac this afternoon to talk about a new kind of heroism. Paula?
Oh, I would say so, Karen, because I think any survival story we do is an important story to do. But the folks in that hospital right now want to call this woman a hero because of what she did. She is an angel in a mask. Rosa Randolph of Unique Food Management prepares meals for the elderly, children, and those who do not have easy access to food.
So we're still serving about 6,000 meals a day.
But look carefully at her eyes above the mask, and you can see excruciating pain and resolve to continue in spite of it. Rosa lost her brother to COVID-19 on a Saturday. He was buried on a Monday, and by Friday, she was ignoring her pain to tend to the pain of others by feeding them. Friday, her first stops were St. Joseph Hospital in Pontiac, and then it was on to McLaren, Oakland. Nearly 400 hot meals of chicken, ribs, and soul food for the soul in all.
Our ICU nurses can't wait to get a hold of their lunch today.
At McLaren, Oakland, this angel in a mask is truly a godsend.
So this pandemic has really hit our staff both physically, emotionally, socially. Our frontline nurses have been working double shifts. We've had up to 35 staff and nurses exposed to corona who have been off.
Thank you.
Our staff isn't able to get away to have breaks and lunches anymore. They're diligently working through their shifts to take care of all of our patients. We have 2 floors full of COVID-positive, critically ill patients. So this is a lifesaver for them.
This is part of helping our first responders, and so many people have stepped up to do that.
For Rosa, the pain continues.
I also lost a brother to this virus. I have a niece that is in critical condition from this virus. And I also have a brother-in-law that is in critical condition from this virus. So I guess for me is to say thanks for the people who are taking care of my family members and everybody else's family members. And I guess the saddest part about it is just see your family member go and there's nobody to talk to them. They're literally going by themselves. You can't go see them, you can't talk to them. So it's been a little difficult.
Yes, the pain will continue, but the hunger will not.
We got to keep going.
Paula Tutman.
Yeah, I'll take it for myself on that one, Karen. You know what? Heroic, Herculean. That's the only thing I can say, and we certainly wish her other family members well.
Truly a hero. We appreciate you sharing that story. Thank you, Paula.